For quads, for the low back relief, we're going to place like our hands are in our pockets, and right where our fingertips end, we should feel a tight band right there. This is actually going to be where we initially start. And then we're going to take the ball of choice and we're going to anchor that tissue. We're going to then lower ourselves down into a front plank position where we're laying on the ball with compression right in that place that we just showed you, where our fingertips would be in our pocket. And then we're going to bend the knee. We're going to flex the foot, bring the heel as back far as we can, and then we're going to rock the heel slowly side to side, mobilizing from the hip itself. We want that femur head to roll in the socket, essentially. If your shoulder doesn't want to hold you up like this, if you can hug a pillow, or you can go flat to the floor like this. You're just going to keep rocking and rocking and rocking. If something doesn't feel, and you can roll off of it, roll it down 2 inches, roll back on, and find your next spot. If a spot doesn't feel super sticky, know that that just means your body doesn't really need the work there. So even if I need the work in that area and it's too tough, we call that numbshell. If we go just 1/4 of an inch, sometimes past it, you'll definitely be able to feel it. So if we can work on the areas that are tender, it's going to help us then create more relief quicker. If we work on areas that are just subpar, that's going to give us subpar results. So if I need to just kind of keep pushing around, see, I rocked off, I placed the ball, I moved the ball down, and then I just rock back in, bend the knee, and this one's way more tender. So this one's tender. If I had stayed somewhere that's not as tender, I would have lost out. So I'm just going to kind of keep palpating around here until I find something really juicy. So I'm going to go back to that last one that I was just in before that other one, and I just slowly pivot the weight into my working leg. You can't really tell, but my opposite knee is going to come out ever so slightly at an angle, just to kind of give me a nice little balance place. And then I'm going to rock, rotating from my femur head. Rotating and driving, reaching my heel farther away. And I'm going to take my breath and I'm going to send it to my leg, right underneath the ball. And I'm going to be using the weight of my leg and a little bit of my muscles to push my body into the ball. And I should feel that connective tissue working as it presses into the ball. We want to kind of think about the ball pressing into the bone, which is really cool. We're getting an internal massage from the bone to the connective tissue to the muscle fibers, and we're getting an external. We're getting the ball to the muscle fibers to the bone. So when we're working both of those, we know that we can actually create long-lasting change in the connective tissue. We're also actually helping and strengthening our bone density overall. So there you go. Keep working that area as long as you feel you need to. Work all those tender points and then come out by rolling off. Or like you just saw, I just kind of bent my knee a little bit and it takes the ball right out.